For so many of us, our dogs aren't just pets, they're family. So when a vet gives you a serious health diagnosis for them, the worry can be just overwhelming. You want answers, you want clarity, and more than anything, you just want to know what the future holds. Well, today we're going to dive into one of the most common heart conditions in dogs and a brand new study that offers exactly that kind of clarity. So, picture this. You're at a routine checkup, the vet's listening to your dog's chest, and then they say the words, "I hear a heart murmur." And your heart just sinks, right? A million questions pop into your head. Is this serious? What does that even mean? What do we do now? For so many dog owners, this is the very first step on a new journey into their dog's heart health. That murmur? It's often the first clue of something called myxomatous mitral valve disease. Yeah, it's a mouthful, but the idea is actually pretty simple. Over time, a really important valve in the heart, the mitral valve, starts to get a little weak, a little leaky. And it happens to be the most common heart issue vets see in dogs, especially as our smaller furry friends get older. But here's the thing, getting that diagnosis of MMVD is not the end of the story. Not by a long shot. In fact, it's really just the beginning of a huge puzzle for both vets and owners. See, the really crucial question isn't just if a dog has it, but how bad is it and how fast is it going to get worse? Okay, so to manage this, vets use a staging system. Let's focus on the early stages, where your dog looks and acts completely normal. In stage B1, you've got the murmur, but the heart itself is still a normal size. But stage B2, that's different. The heart has actually started to get bigger to handle that leaky valve, even though your dog is still happily chasing squirrels and wagging its tail. And that difference is absolutely critical. And this is where that puzzle gets really tricky. Stage B2 isn't one single thing. It's an incredibly diverse group. I mean, some dogs can hang out in this stage for years and be perfectly happy. But others can go downhill and develop congestive heart failure surprisingly fast. For a vet and an owner, that uncertainty is just the absolute hardest part. You can almost think of stage B2 like this. It's one single diagnosis, but inside that box are dogs with two totally different futures. And up until now, telling them apart has been a massive challenge. How do you give someone an accurate prognosis? How do you decide how often to do checkups? What vets have really needed is a better tool, kind of like a crystal ball, to see what's coming a little more clearly. And that is exactly what brings us to this big new study. Researchers set out to create and test a scoring system that could act as that crystal ball to help figure out the risk for these dogs. They called it the MindScore 2. Now, this wasn't some small effort. This was a huge study that looked back at the records of almost 750 small and medium-sized dogs from all over Europe. And the goal was simple. Take a risk score that already existed and make it way easier and more practical to use in a regular vet clinic. The whole mission was about one thing, simplicity. The big question was, could they accurately predict a dog's risk of getting sicker using just 3 key measurements? The kind of measurements that are already taken during a standard heart ultrasound. So what are these 3 magic measurements? Let's break them down. First, the size of the left atrium. That's the chamber that gets the oxygen-rich blood. Second, the size of the left ventricle. That's the heart's main pumping powerhouse. And third, the speed of the blood flowing into that ventricle. All 3 of these are fantastic clues about how hard the heart is having to work. And the next part is just beautifully simple. The researchers just assigned a point value to each measurement, a 1, 2, or 3, based on where the number fell. Then you just add up those 3 scores, and boom, you've got a total min score. That's it. So the million-dollar question, did it work? Can this simple little score actually help predict the future for a dog with this heart disease? Well, the results were wow. They were incredibly powerful. Okay, so this graph from the study basically tells the whole story. Each of these lines is a group of dogs based on their MIN score, mild, moderate, or severe. And that downward slope shows how many dogs had a serious cardiac event over time. You can just see how cleanly the score split them up. I mean, there's no overlap, no guesswork. These are 3 totally distinct groups with 3 very different futures. Let's put some real numbers on those lines, because this is where it gets real. For the mild group, the average time until a cardiac event was over 2,600 days. That's more than 7 years. For the moderate group, it was about 1,200 days, so just over 3 years. But for the severe group, that number dropped off a cliff. 718 days. Let that sink in. For dogs that the MindScore flagged as severe, The average time until they developed heart failure or had a cardiac-related death was less than 2 years. Having that kind of forecast can completely change the conversation a vet has with a pet owner about what to expect.
But hey, remember our big problem? That prognosis puzzle? The real acid test for this score wasn't just whether it worked on all dogs. It was whether it could solve the mystery of those unpredictable stage B2 dogs, that mixed bag of slow and fast progressors.
And here it is. This is really the mic drop moment of the entire paper. When the researchers looked only at the dogs in stage B2, the MIND score worked just as well. Look at that separation. It could clearly pick out the mild, the moderate, and most importantly, the severe, high-risk dogs, all hiding within that one confusing stage. It found the signal in all that noise. So what does all of this actually mean for the future of treating this disease? I mean, this isn't just a fancy chart in a journal. No way. This tool could genuinely change how vets and owners manage a dog's heart health, creating a much, much clearer path forward. Because the results were so powerful, the authors made a pretty bold proposal. They suggested creating a whole new subcategory, stating, dogs in stage B2 classified as severe can be defined advanced B2. So what in the world is advanced B2? Well, it's a name for those dogs that look totally healthy on the outside, but whose hearts, based on those 3 simple ultrasound numbers, are telling a very different story. They're the dogs under the most strain, the ones at the highest risk, and the ones who really need the closest watch. Look, at the end of the day, this is why the MIND Score 2 is such a game changer. It gives vets a simple, objective tool they can use. It gives owners a much clearer, more accurate prognosis, which replaces all that awful uncertainty with actual data. And that allows for personalized care. An advanced B2 dog might get a checkup every few months, while a mild dog might only need to come in once a year.
You know, it's pretty amazing to think that by turning some complicated ultrasound data into one simple, predictable number, we could change the entire conversation around one of the most common diseases our best friends face as they get older. This research really shows that with the right tools, we can move from just diagnosing a disease to actually forecasting its future. And that means giving our dogs the best, most personalized care we possibly can.